Joining us this morning is Dr. Roubion with Metairie Orthopedics and Sports Medicine. Okay, we were just talking about this during the commercial break. Pickleball, lots of folks getting outside. Injuries happen. Tell us about some of these injuries that you see during the summer months.
Yeah, so I think we need to rename the tennis elbow to pickleball elbow. You know, you have a whole host of things that can happen. We have traumatic injuries. People can fall. They can break a bone. That's obviously very, very acute. It's pretty clear what happens there. But then you have the overuse things, the playing pickleball every night for several months, and now my elbow is starting to kill me. So that's kind of more of a chronic overuse injury. So we see the whole gambit.
Okay, so pickleball, to me, I don't play pickleball, but the types of injuries that you can get, I don't think of that sport as something that's aggressive or contact or something that could give someone a lot of injuries. What types of injuries are they getting in something like pickleball?
Just come to our league games. I mean, you'll see it.
There we go.
but no, I mean, think about this, okay? All your musculature around your joint is supposed to support that joint. So if you have a strong quadriceps muscle, it's going to support your knee. As we get a little bit fatigued, as we play for an hour or 2 hours, then that knee becomes a little bit unstable, and then we cut and pivot the wrong way, and something can happen. So we see kind of those acute type of things, and then the overuse things like I talked about.
Let's talk about the overuse. You were saying there's some of these pickleball, these athletes, if you will, leaving work, biking to the court there, and just jumping right in the game without even warming up.
Yeah, perfect example. We always say, we're coming into the pickleball game on 2 wheels, and we'll be there, 30 seconds before the game. In a perfect world, you get there 10 minutes, 15 minutes before. You would do a proper warm-up, a little bit dynamic warm-up, get the joints moving. That way that first burst of energy doesn't pull a muscle.
And overworking, people are addicted to pickleball. They love the sport. So it's playing it all day, every day, multiple hours can really lead to that fatigue.
I think the hardest conversations we used to have were with the youth baseball players and say, hey, you really shouldn't pitch this weekend or maybe take a few weeks off. Now it's the pickleball players. You say, hey, you really got to take a couple weeks off and let that shoulder rest. It's like, well, Doc, I have a tournament next weekend. I can't take a break.
That's the heartbreak there, the heartbreak, delivering the bad news. What other sports? I know people they got tee times as well. They want to take up running, maybe doing some of those races on the weekends. Talk about some of those other injuries.
Yeah, so we're seeing a lot of golf injuries, a lot of people playing multiple rounds every weekend. They're trying to get it in, before the July and August heat comes around. So this is prime for that. We're seeing a lot of chronic tendonitis in the elbow from the golfers, some low back trouble as well. So, if you're strong and you're mobile, it'll keep you out of trouble, but also you have to think about how much you're playing.
Yeah, it can happen to anybody. And how do you know the difference between, oh, I'm just sore because I played, 4 hours of pickleball versus this is an injury?
That's exactly right. So I think there's that happy medium between I injured myself this morning versus I hurt myself 6 months ago. If it's really inhibiting you doing your activities of daily living, that's a problem.
Yeah.
If it's not getting well after 1 or 2 weeks, that's a problem. So, a lot of these things you can seek treatment early, you can get well quickly, but if you don't, it can become nagging.
Is age a factor, or is it just, it can happen to anybody?
Certainly, but nowadays, we're all about our biological age now versus just chronological. So we see athletes of all different types. We see extremely healthy 60 and 70-year-old people who are very, very in shape, and vice versa. You can have a 30-year-old person who is the opposite. So
okay, there you go. Anything can happen. A lasting advice for someone out there who's thinking, I'm going to lace up the sneakers this summer, I'm going to get out there and get active?
Just listen to your body. Take it as a stepwise approach. Don't go from 0 to 100 tomorrow. Really build yourself up slowly and listen to your body.
And take rest. Rest days are important.
Please.
All right, Doc, thanks for being here. We appreciate it. Good advice.